Good afternoon. I'm Mandy Cohen. I'm the Secretary of Health and Human Services for North Carolina. Thanks for joining us this afternoon. I'm joined by Director Sprayberry, as well as Brian Tipton and Nicole Fox doing our American Sign Language interpreters, and working behind the scenes are our Spanish interpreters, the sisters Jackie and Jasmine Matevier. So I'm going to start with a rundown of the numbers, and I'll turn it over to Director Sprayberry. As of this morning, 89 counties in North Carolina have COVID-19 cases. We have 2,870 cases now in North Carolina. That's up about 800 since just Friday. Of these cases, 8% of them are ages 18 to 24, 48% are ages 25 to 49, 28% are 50 to 64, and 21% are over the age of 65. We currently have 270 people hospitalized. This is up another 11 since Friday. And sadly, we've had 33 deaths. That's another 14 people since Friday that we've lost. Obviously, our hearts are with those families at this time. We've done more than 40,000 tests that have now been completed across labs, from the state lab to private labs to our academic partners. They have reported those as negative tests, though not all do report. In addition to these numbers, this morning, a collaborative of North Carolina data experts from the private and public sectors released a North Carolina-specific modeling forecast, looking at how COVID-19 could affect our state in the coming months. The model reinforced the things we're already doing, the need for social distancing to slow the spread of COVID-19 and ensure that hospital care is there for the people who need it. The team found that the social distancing policies we currently have in place in North Carolina will help lower the likelihood that we'll overload our healthcare system. That's good news. On the flip side, they found that if we ended those social distancing efforts at the end of April, it could lead to a greater than 50% probability that we will outstrip our acute care and ICU bed capability, possibly as soon as Memorial Day. They also found that if social distancing was to stop at the end of April, roughly 750,000 North Carolinians could be infected by June 1st, as opposed to around 250,000 if some form of effective social distancing remains in place. Social distancing flattens the curve so that fewer people get sick at the same time. We know when people aren't coming into contact with each other, it lowers the chance that they will either catch or pass on the virus. So that was a lot of news this morning, and I'm sure we'll answer your questions about that. We also heard over the weekend about face coverings and what role they play in slowing the spread of the virus. First, I want to note that face coverings are not the same thing as the face masks that are needed by our healthcare providers and first responders. The Centers for Disease Control updated its guidance over the weekend and recommends wearing a cloth face covering in public settings where other social distancing measures are difficult to maintain, such as in grocery stores or in pharmacies. They are not recommending medical face masks. Our supplies of face masks need to go first to those on the front lines. Our healthcare workers need protection. But for the rest of us, cloth coverings can play a role in controlling the spread if they are used properly and in combination with other tried and true things like washing your hands, wiping down surfaces. If used incorrectly, face coverings can expose someone to more germs rather than less. The very best evidence on reducing the spread of the virus is to social distance and stay home. So please help us to continue to save lives by staying home. I'm going to turn it over to Director Sprayberry, and then we'll take your questions.
Thank you.
And you were just listening in to a press conference from Dr. Mandy Cohen, the Secretary of the North Carolina Department of Health and Human Services. She reported 14 more deaths in North Carolina since Friday, but she says social distancing policies that the state has in place will help avoid overwhelming our healthcare systems in the state. She says new models out today show that if we stopped social distancing, we could easily overwhelm those healthcare systems like hospitals. You also heard her mention cloth face coverings. The CDC is now recommending that people wear those cloth face coverings when they go out in public settings when social distancing is hard to maintain. She says she is not talking about medical face coverings like N95s because, of course, we need to get those to our healthcare workers. Let's check in now with Christian Morgan.
And if you're looking for some good takeout ideas while we practice our social distancing, I think I found a way. It's a collection of local restaurants and folks just like you and me who are looking for dinner ideas. It's called the Greensboro Takeout Facebook page. And today I caught up with Kim Brewer, who's the owner of Melt Kitchen Bar and Restaurant. And she talked to us just a little bit about how that Facebook page is helping them and helping their business thrive in a time that's really uncertain right now.
Since the shutdown on the 17th, it's been kind of a day by day. We're having to adapt to what customers their needs are. So, we're relying really heavily on social media and, feedback from our customers and kind of deciding what we're going to be offering based on those things.
Sure. And one thing that I think has been really helpful, especially for the Greensboro community, is this Greensboro Takeout Facebook page. And that's actually how I found out about you guys still being open and still doing takeout. So how has that helped you, and how have you kind of used that page to maybe garner up some more business or kind of get the word out that you guys are open?
It's been a big help. It seems to have come together really quickly, and people were joining, at lightning speed and asking who's doing takeout, who's doing curbside. People are really communicating through that. For people to go on to that Greensboro Takeout Facebook page and just scroll around and check out some new places, including Melt.
All right, and taking a look at your weather outside. It's a really nice day, a warm day, much warmer than we had over the weekend. We are in the upper 70s, even 80 in Greensboro right now, just under that 79 at the current moment. On the radar, it's been pretty quiet for the most part today, but we are watching some of those very isolated, very pop-up in nature showers that we were talking about earlier that we did have the possibility for, and the possibility for one of those to pop up a storm. Again, not expecting any widespread storm activity, just the low end chance that you could see one in your neighborhood. And if you do, it could pack some gusty winds if those storms do form. As we head through the overnight hours, those storms and those showers will start to thin out and fizzle out. We'll be under partly cloudy skies tonight, down in the mid 50s for overnight lows. And heading into your Tuesday, going to start out in the 50s, warming up in the mid 70s by lunchtime, and right around the 80-degree mark in the afternoon. We'll watch for a few showers and pop-up storms tomorrow afternoon as well.
Hello. I have a lot of comments, like I put a lot in there, so if you don't want me to read all of them, just say last comment. The new recommendation from the CDC is that we all wear masks when we are out and about, but there are some that work better than others. Wake Forest Baptist Health tested a number of homemade masks, and they say the fabric you use is what makes a difference of it working or not. So a team of doctors and scientists looked at about 13 different designs from about 400 masks that were made by community volunteers. Now, the goal was to find out which type of mask filtered viruses and bacteria compared to a standard surgical mask and those N95 respirators. Now, the best homemade masks achieved 79% filtration. Compare that to surgical masks at 62 to 65%, and N95 masks that filter 90 bacteria.
Yeah, so I'll pick it up to Haysha. She was saying that those N95 masks, they filter out 97% of viruses and bacteria. That same research found that some masks barely did anything, filtering out only 1%. So all of that being said, what should you reach for if you want to make a homemade face covering? Well, the team said the best performing design was made of 2 layers of high quality heavyweight quilters cotton with a thread count of 180 or more. Thicker threads like batik worked as well. The researchers say a double layer mask with a simple cotton outer layer and an inner layer of flannel also performed pretty well in their study. Researchers did find that lightweight cotton performed the worst, but again, they say you can make that mask with a lower quality fabric as long as it has that internal layer of flannel. So of course, we are all feeling the impact of this pandemic, and WFMY News 2, we want to keep checking in with you in a new way though. Ben Briscoe explains.
Hey Triad, how you doing? What we're going through is unprecedented, and it's bringing up some new feelings in all of us. Perhaps you're longing to be inside your favorite restaurants and bars around town once again. Maybe you're stressed trying to help the kids do all that schoolwork at home. Or you could be overjoyed because you finally found a store that has toilet paper or a new way to use your phone to connect with friends. No matter how you're feeling, we want you to be 100% real with us right now and share your thoughts. That's why we set up a new phone number for you to call in and share. It's 336-379-5604. Leave us a voicemail and let us know, how are you, Triad? We could use part of your recording in a future story. In Greensboro, Ben Briscoe, WFMY News 2.
I hope this is better. Does that sound any better? Hello, mic check 1 2 3. This is just so frustrating. Okay, so hopefully this works now. I twisted things around, so we'll see if that works.
Welcome back to your 4 to 5. You know, we talked a lot about this empty grocery store shelves, but what about the people who grow the food that goes on those shelves? Farms are also affected by COVID-19. Beverly Mooney owns Millstone Creek Orchard in Ramseur. They grow berries, apples, peaches, and pumpkins, to name a few. Their main product, though, is agro-tourism, people coming to pick their own produce, and that's come to a halt during this outbreak. It's the money from visitors, she says, that supports the farm, and right now they can't visit. Still, Mooney has farmers and workers to pay even during their off season, and so do other local farms.
We have to keep our head above waters. This is not a busy time for my farm, so we don't anticipate a lot of traffic, but this is the time of year we try to make payroll. And we have two farmers that are critically needed out to get ready for these great crops to come to harvest later this year. So for us, initially was to keep our head above water. But then we started thinking about my neighbor that's a strawberry producer. How's his strawberry crop in 3 weeks going to get to market?
And that's why Mooney launched a mobile market and is now delivering products 4 days a week from 10 local farmers and food producers within a 15-mile radius of Millstone Creek Orchards. That's the delivery radius. She even recreated her entire website to make online ordering an option for people. She's selling local produce, sauces, jams, and baked goods to help her farm and her neighbors.
So I started talking to other people and go, wait a minute, this is bigger than us. And the biggest thing I have found in the delivery aspect, not curbside as much, but delivery, is we're serving a lot of our seniors. And that was a little bit a lot humbling and surprising. Those were the folks that go, we can't get out. And we do not even interact with these clients. We actually come there, they tell us where to leave their product. We leave it, we send them a text or a call as we leave, and they know their product is there. And it is a very safe form of getting this food to them.
So this week, starting on Wednesday, Mooney says the Easter Bunny is going to help her make some of those deliveries and wave from a distance so the kids don't have to miss out on Easter this year. You can also order items for curbside pickup. Just go to millstonecreekorchards.com.
Let's go back to one of the big talkers of the day, and that's the CDC's new guidance on wearing cloth masks when you are out in public. So I posted on my Facebook page today asking you, in light of this guidance, how do you plan on getting your hands on some masks? So let's take a look at what some of you had to say. Ken Woods writes, I'm a healthcare worker. A local church made masks for us with an opening to add a filter to it. Linda writes here, have some purchase for allergies this time of year. If I run out, I will make some. She's crafty there. Luckily, I sew and have a sewing machine. Michelle writes, bought handcrafted from a lady who is making them. Not the same as hospital quality, but then again, I am not a medical responder, and the CDC is saying really those surgical masks need to go to first responders, so good on you, Michelle. Barbara writing here, I'm going to make some masks. I have all of the materials, but not planning on going out, but you never know. And Maddie, I do think, you know, this virus is evolving, and how we respond to the virus is evolving as well. And you know, there are a lot of different homemade masks that people are making. And one thing I saw that was interesting, the CDC posted for the people that are using those bandana masks, they say put a coffee filter actually in that bottom layer before you start rolling as an extra layer of protection.
Oh, that's a great tip, Tahisha. Yes, I do not have a sewing machine, but I did watch some tutorials online. They're very easy to find patterns and tutorials for no-sew masks as well. You just need a bandana or a cotton covering and 2 hair ties, and you can whip something up. And again, everything's changing. Like you said, every single day we are learning more about this virus, and a lot of people didn't realize that now the CDC is recommending that everyone who goes out in public try to have something over their mouth and nose.
Right, and I would add that if you are wearing a mask for a long period of time, what I have seen some people do is take a headband and they sew buttons on the headband so that the straps go around the buttons and they aren't impacting your ears, kind of stretching them down for a long period of time.
Good point. A lot of good tips from you today, Tahisha. Thank you so much. You know, it can be a little bit frightening to see people out in this PPE and masks and gloves like this, but it is another precaution that we can take, not just to protect ourselves, but others. More of the 4 to 5 is coming up right after this break.
And taking a look outside right now, weather-wise, for the most part, it's been a dry day. However, looking at the radar, we do have a few storms that have popped up across the Triad area. One right now, pretty strong. It could be packing 45-mile-per-hour wind gust moving over Greensboro. And then also one down just to the southwest of High Point and also down near Denton as well and around the Lexington area. Those storms are moving southeast. Again, not expecting anything to be really severe or too strong, and they should start to fizzle out as we go through the rest of the evening. You can see on Futurecast, really the shower and storm activity comes to a halt tonight, really after about 8 o'clock, and we'll be under partly cloudy skies tonight, down to 54 for your overnight low. Tomorrow, another day, pretty much like today, close to 80, partly cloudy. A few isolated showers and storms are possible in the afternoon. Some of those could be strong. It's just something that we'll keep an eye on. Temperatures climbing up to the 80-degree mark for the middle of the week. We are dry, and we cool down in a big way heading into the end of the week and into next weekend.
Hey, ice cold milk and an Oreo cookie.
Welcome back to your 4 to 5. I'm Maddie Gardner, joined by Christian Morgan and Tahisha Moyes, who are both at home this afternoon. We will, of course, check in with them for the latest headlines and the forecast in just a few moments. We are here to inform you, really make you feel connected, and let you in on our world. We want you to use our hashtag 4 to 5 on social media so we can see what you are talking about. Meantime, let's get you caught up with the latest this afternoon. Guilford County students are on spring break this week, but it's not keeping one Greensboro company from helping kids who don't have access to a computer for that online learning once classes resume. Brady Services, an HVAC company, donated more than 90 laptops to the Guilford County Education Alliance. They say they recently updated their computers and had a surplus of laptops that they didn't need. GCS has a poverty rate of 66%, and many students don't have a computer at home. Laptops donated by Brady Services will be reconditioned and then given to students in need. Now to your 4 to 5 roundup. The Wyndham Championship has been moved. The golf tournament at Sedgefield Country Club will now be August 11th through the 16th, just 1 week later than originally scheduled. The changes were made because of other PGA cancellations and postponements. Well, Sherwin-Williams, the paint company, is the latest to help those on the front lines of the COVID-19 pandemic stay healthy. They are now making hand sanitizer and providing coatings for equipment like ventilators, oxygen tanks, and hospital bed frames. The sanitizer will also be given to those who need it. The company has donated 250,000 masks, gloves, and lab coats to various hospitals and state agencies. High Point University is also giving back in the wake of the virus. The university donated 14,000 water bottles to various organizations in the community. They also donated 5,000 ponchos to Guilford County EMS. More than 4,000 meals have also been given to Open Door Ministries from the university, and $300,000 was donated to United Way of Greater High Point. The city of Greensboro is making additional water, sewer billing and payment changes. So if you're struggling to pay your bill, you can now enter a payment plan. If your water was cut off for a non-payment before mid-March, the city will reconnect until the end of the COVID-19 emergency. You just need to give them a call. The city is also waiving the $1 convenience fee, if you pay online or on the phone.
Another Greensboro company is making sure that hospitals have what they need to fight COVID-19. Contour Brands, that's the parent company of Lee and Wrangler, will be making 60,000 hospital gowns. They announced today they'll produce 50,000 level 1 patient gowns and 10,000 disposable isolation gowns. Greensboro-based Precision Fabrics Group donated the fabric for those disposable gowns. Now, the federal government has approved companies to send certain medications straight to hospitals. Those hospitals are able then to stockpile those medications in case it becomes an approved drug for COVID-19, and this really impacts lupus patients. Erica Proffer tells us how those changes, though, could hurt the people who really need those drugs.
I don't let it disable me. I don't treat myself like that. I'm sick.
It took hospitalization before Lana De Leon found out why she was feeling so bad so often.
I was hospitalized and we didn't know what it was. And
several tests diagnosed lupus.
Every day for me is like having the flu.
But the meds she needs are in short supply. Lupus patients need hydroxychloroquine and chloroquine, the same drugs the FDA approved to go straight from manufacturer to hospitals.
You have to have a prescription written from a rheumatologist.
Adrienne Cullenberg is with the Lupus Foundation Lone Star chapter. The foundation sent a letter to the White House asking to prevent unreasonable price increases and ask for refills of a 90-day supply for lupus patients.
Everyone is trying to afford these medications. They would not have enough medications.
Allison Benz, the executive director of the Texas Board of Pharmacy, needed to make sure pharmacies kept their stock. The board issued an emergency order, limiting allotments to 14 days. Refills needed a new prescription.
They needed to survive.
The foundation again sent letters, this time to all states, saying 14-day supplies creates barriers, also puts them at greater risk for exposure to COVID-19 by requiring them to travel outside their home more frequently to fill their prescriptions. At the time of this interview, De Leon was down to a handful of pills, called several pharmacies, started lowering her dosage to stretch out the supply.
I'm starting to feel pain, but, what can I do?
It took several more days, but Lana got some meds at a local pharmacy. The Lupus Foundation recommends an online pharmacy if you have trouble locally, but issues caution.
We are learning more about COVID-19 every day, and now here is another reason to really follow that stay-at-home order. The nation's top infectious disease specialist says that as many as half the people infected with the virus will not show any symptoms. That's a much larger estimate than the CDC gave last week. Dr. Anthony Fauci said somewhere between 25 and 50% of patients are asymptomatic during a press conference from the White House on Sunday. He did say that's only an estimate at this time and recognize that he and other scientists disagree.
And taking a look outside, for the most part, it's been a dry day, but we are tracking a few pop-up showers and even a few pop-up storms across the triad now. If we zoom in on a closer look on the radar, you can see we've been tracking that storm over Greensboro, moving to the southeast. It was packing some strong winds at about 45-mile-per-hour gusts in there. There's also a strong storm just to the south of High Point And then there's another storm just south of the Triad, south of Davidson County, down into Rowan County. That shouldn't be a problem for us. But those are the things that we're keeping an eye on as we go through the next few hours. Those storms and those showers will start to fizzle out, though overnight, partly cloudy skies will be down to 54 for the overnight low. Again, another isolated shower or pop-up storm is still a possibility. We've got this cold front that's kind of parked to our north. It's a stationary front, and as we get some daytime heating, even tomorrow too, we could get another afternoon of some pop-up showers or storms that could be strong and pack some strong wind gusts in there. So starting out with partly cloudy skies tomorrow, we'll watch for a few of those pop-up showers and storms tomorrow afternoon. 7-day forecast, we stay warm through the middle of the week, but we are dry and we are much cooler to end the week.
Okay, guys, here is the softball question of the day. When is tax day this year?
Yeah, Danny, it almost seems like a trick question, but it's still the 15th.
Right, and it's the 15th of July, not April.
Right, of July. Correct. Both federal and state filing dates for tax returns is July 15th, but there's always a but there, isn't there? If you owe money to North Carolina and you file by July 15th and you pay the money then, the state is still going to charge you interest on that payment all the way back to April 15th. Now, this is going to take a lot of people by surprise.
So why is this happening?
Okay, so the state legislature has to change a law to stop these interest payments, and so far, well, that is not happening. How much in interest the state is charging and what tax accountants want done about this, that is coming up at 5 o'clock. Now, when that stimulus money comes, what should you do with the money? The short answer is, whatever you do, don't put anything on your credit card.
What I would strongly recommend is before spending money on your or putting those bills on your credit cards, reach out to your bank.
And of course, the thought might be, I will have to put a bill on my credit card, but
what you're doing then is really just starting that bad cycle, right?
It is. I mean, you kind of think, well, I'm getting the bill paid, but really, we're going to talk about how to make sure that you don't take the place of rack up more money than what you owe already. We're going to talk about that come up at 6 o'clock. And we're also talking about your health questions starting at 5:30. Text your questions, 336-379-5775. An expert from Cone Health will be here. You can hear the answers right here on WFMY News 2.
I had walked away. Hi there, 1, 2, 3, 4, 5, 6, 7, 8, 9.
at WFMY News 2, we want to know how you're feeling. It's another way we're staying connected with you. You can now call and leave us a voicemail to tell us how you're doing. Our own Ben Briscoe is giving us a listen at what some of you are saying.
Hello?
Hi there. Hello.
So many of you called in to talk about the wave of emotion going across the triad right now.
An eerie feeling. You don't know what to think.
I've been staying in the house for the last month.
Because my husband is used to being going all the time. It's hard on him.
I'm lonely. I don't want to be around people because I'm scared of getting that virus.
I've been to the Lowe's in Reesville, and it looked like it was 100 people in there because they won't keep the 6 foot apart. And I'm feeling very disgusted with all these idiots out here that do not take this serious. I'm sorry, but you can't fix stupid. People stay at home.
You shared your ups and downs.
Biggest question that I have, what is the problem with the toilet paper? I cannot find any.
It's just been hard getting unemployment because I don't have a computer and I don't have the Wi-Fi.
I have a special needs son. He's at Caswell Developmental Center. Can't see him except FaceTime on an iPhone. He doesn't understand why I can't come home. And he says, "Home, Mom." And it's really painful. I can't go to the windows because Elliot would want to come outside. I can't go near him. I don't want him to think we don't love him and that we don't want him home, because we do.
I'm kind of feeling emotional tonight because I started thinking about all the people that are out of work. The stories I hear from my clients are heartbreaking, but I have to be very strong for them, and I have to be very positive, and I have to encourage them, and I have to let them know that things are going to get better. They are.
I'm able to enjoy my front porch and say hey to the neighbors when they come out.
I find it's not hard to amuse myself. Television is a wonderful companion at this time.
And you also shared about the higher calling getting you through.
I have my antidote for coronavirus, and that is prayer.
We're in this thing together. We are trying to reach out and call as many people as possible, calling our elderly neighbors. I'm sending out cards.
I think of the people who are out on the front lines, and even if I wanted to complain, I wouldn't, period. So we're going to make it.
And when we go back to normal, it won't be the normal that we're used to. And I'm okay with that. I can adapt.
I'll be glad when this is over with. That's all I'm saying. And God bless y'all.
Thank you for giving me a chance to talk.
Everybody has a good day. Bye-bye.
Yeah, it certainly is an unprecedented time, Taheisha. It's one of those things where we're going to talk about before the COVID-19 outbreak and after it. But it is a little bit reassuring to know that we're all in this together and everyone in some way is grieving something.
Yeah, and it was really gut-wrenching to hear some of those messages. That one person who couldn't visit her family, and she, oh my goodness. But I do want to say this, you know, we are going to get through this, and I just want to take this time again to say thank you to our healthcare workers who are on the front line. I spoke to one of my best friends in healthcare, and she says things are tough, but this is why we got into healthcare, is, you know, to help people. So to everyone struggling out there, we are all thinking of you, and there are brighter days ahead.
Well said, Taheisha. Heroes wear scrubs. I've seen that floating around social media. I think it is perfectly timed for this moment. All right, Christian Morgan, let's hear a forecast.
Yeah, for the most part now, it's a little bit of a busy afternoon. We do have some pop-up showers and even a few pop-up storms across the area. If you take a look at our radar, you can see it's kind of peppered with some of those scattered showers. But really, if we zoom in on a more local view of our radar, you can see we did have that storm moving over Greensboro. It was packing some strong wind gusts around 45 miles per hour. There was also another pretty strong storm just to the south of High Point that we're watching. And these storms really sound a lot worse. They're a lot louder than they actually are. But some of them could pack some strong wind gusts, and that's something that we'll keep an eye on, not only today, but also tomorrow as well. We got a front that's kind of parked itself along the North Carolina-Virginia border. It's what we now call a stationary front. And as it stays there, along with some general daytime heating, because it is getting warmer outside, that's what could pop off a few of those showers or even a few strong storms tomorrow afternoon as well. High pressure down to our south. That continues our warming trend through the middle of the week before another cold front comes through here and cools things off for the end of the week. Temperature-wise right now, we're still in the upper 70s to around 80 in most of the Triad areas tonight. Under partly cloudy skies, we'll get down into the mid-50s. So any of those showers or storms will really start to fizzle out as we go through the evening hours and we lose some of that daytime heating. For tomorrow, breezy and warm, a day pretty much like today, 81 for the high. Again, partly cloudy in the morning, and we'll watch for a few pop-up showers or storms in the afternoon. Your 7-day forecast, we keep that low-end chance of a few showers and storms really through the middle of the week. Also, as our temperatures start a gradual climb up into the lower 80s before things finally cool off, and in a big way, back to the lower 60s, and we are dry for Friday and Saturday. It'll feel really cool to your body compared to those 70s and 80s that we've had this week. So we're back to the 60s by the end of the week and heading into next weekend.
Coming up on WFMY News 2 at 5, U.S. Surgeon General Jerome Adams and health officials say this could be the hardest week in America during the coronavirus pandemic. A closer look at what that means and why the U.S. Department of Health and Human Services wants you to limit your trips to the grocery store. That is next on WFMY News 2 at 5.
I can talk, Tasha. How are you there? Christian, man, you are killing per usual. Okay, I got a mic here, so maybe I can get a little closer. Let's see if I can move. Mic check, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You still can't hear me. I don't know why. Michael could hear me earlier. What's up, everybody? It's right here. Yeah, the red dot's on. I'm hitting it. The red light's on. Look. Hello, hello, hello. Can you hear me now? There we go. There we go. There we go. We're good. No worries. We're good. No worries. 1, 2, 3, 4, 5, 6, 7, 8, 9.
Welcome back to your 4 to 5. Britain is bracing for soaring death tolls this week, but Italy and Spain are starting to see their numbers fall. CBS's Ian Lee is in London with the latest on the COVID-19 outbreak in Europe.
In coronavirus-ravaged Italy, it's hard to see hope with scenes like these, but the country did record its lowest daily death toll in 2 weeks. Pope Francis offered encouragement during his Palm Sunday service, telling followers, "In the tragedy of a pandemic, have courage and open your hearts to love." The demand for coffins has risen dramatically in Spain, even though the number of deaths there has fallen for a 4th consecutive day. The death toll is climbing quickly in the UK, even amid a lockdown. The country recorded its 3 deadliest days so far. British Prime Minister Boris Johnson was hospitalized as a precaution after struggling with the virus for more than a week. President Trump wished him well.
I want to express our nation's well wishes to Prime Minister Boris Johnson as he wages his own personal fight with the virus.
I'm speaking to you.
And in a rare TV appearance to the nation, Queen Elizabeth urged resolve while evoking Britain's wartime spirit.
We should take comfort that while we may have more still to endure, better days will return. We will be with our friends again. We will be with our families again. We will meet again.
The question everyone wants to know is when. Ian Lee, CBS News, London.
Well, before we go, we want to spread some joy to you. And who better to do that than our digital guru, Jalen Gilkey. He is at home telling us what's making you smile.
Yes, and so as you know, here at WFMY News 2, we've been looking for reasons to smile. And as we've been traveling throughout the triad, we've been seeing these beautiful pieces of sidewalk art. If we can jump to our first picture, it comes from the Barker family. It's a beautiful stained glass spiritual message here. And it says, "The Barkers are praying for you." If we go to our next image, it comes from Anna Armstrong out in Stokesdale with an absolutely wonderful Simba rendition. Look at the coloration on the ears. This is some real talent here. It's some great detail. Our next one comes from one of our own, Brad Lowry, and his niece Haley in Greensboro with a message of hope for all the neighbors that drive by. Super talented. And Courtney, she shares this picture of a religious, spiritual picture from her kids as well. It's just something that we all need right now just to lift our spirits. Some beautiful artwork and some super talented people in the area.
I'm so impressed with all of those masterpieces, Jalen. Thank you so much for sharing those. Reminds me of stained glass windows on a church. Simply beautiful. Hey, we want to see what's bringing joy to you. Remember, we have our hashtag #JoyToYou. Make sure you use that when you post anything that's making you smile these days. The 4 to 5, we'll be right back.
Came. Yes, as officials warn us to brace for the hardest week, the U.S. Department of Health and Human Services.
Hi there, doing a mic check. We're talking about some thunderstorms that have been moving through the area. None of them are severe, but they are interesting. Was
complete, but her groceries weren't at her doorstep. They weren't in her. Hey, mic check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The sun is shining now. It was.
Hey, I just am putting the prod in that last bit for 5 o'clock so you can code it.
Hi there, Callie. 123, 123, 12345.
It's time for my 2 cents. You know, all anyone has been able to talk about the past few weeks is the coronavirus. I'm guilty too, because it's so hard not to focus on it. Not just the virus itself, but how it's affecting our everyday lives. Working from home, schooling from home, and the list goes on and on. I don't know about you, but I sure could use a break. So I wanted to share with you a few things I do on the weekends when I'm off to help clear my mind. Number one is I try to take a virtual class. For me, it's Spanish. It's something I did in person before the virus hit, and it's something I want to keep up with while I'm cooped up at home. But for you, maybe it's a virtual workout class or an arts and craft project that's streamed from start to finish. Number two is I catch up with loved ones. We were made to communicate with people, and it's more important now more than ever. So I encourage you to call your friends and family. Video chat is great too if you have that capability. More times than not, you will feel better after stepping away from that conversation. And number three, I sleep in. It's amazing what a full night's rest can do for you. I feel like a different person, really, and wake up with a much clearer mind, ready to tackle the day. So do what you can to get those extra Z's. I'm thinking of you all and want to make sure we're minding both our physical and mental health. That's my 2 cents and your 4 to 5. WFMY News 2 at 5 starts right now. The number of coronavirus cases continues to rise across North Carolina, but health officials say we can still stop the spread if we are all practicing social distancing.
We are here to make sure you're getting the latest, most accurate information. So here's a closer look. Davidson County health officials have reported their first death from the coronavirus. They say the patient was in their late 80s and did have underlying medical conditions. In Guilford County, there have been 104 confirmed cases and 4 deaths. Forsyth County has seen 99 cases. Health officials say 45 of them have recovered. Americans